Do you think it's right that some of the lockdown measures are being eased from tomorrow?
Well, I think it depends what your objective is. If your objective is to say that the virus needs to spread through the population and you just need to stay within health service capacity, then yes, it makes sense to open up right now when there's excess NHS capacity and you have the ability to treat everyone who needs it. If your objective is to contain the virus, to drive numbers down, and to try to, in a sense, get rid of it so no one is exposed to it, then it is not the right measure right now to open up.
I mean, there are currently 8,000 new infections in England, according to the Office of National Statistics. What level do you think that should be at before we start to ease the lockdown?
Well, if we look at other countries which have been opening up and which we want to be in the position of, I'm thinking, South Korea, Australia, New Zealand, Norway, Denmark, Germany, they've been able to bring down infections at least to the low hundreds, ideally into the double digits. To be standing at 8,000 infections a day and to think a testing and tracing system can do the work, what you really need is a package of interventions, and we're really far off on that, and we don't really have good enough data systems to be able to monitor at the local level. So it's a big risk and gamble. We're exiting lockdown with a larger number of deaths than we did when we actually entered lockdown months back.
Members of SAGE, the scientific committee advising the government, have spoken out to say that some of them believe that the lockdown is being eased too early. The government's own COVID alert system hasn't actually reduced from a level 4 to a level 3. Do you think the government can really still say it's listening to the science?
No, it's clear that there's a divide now, and these are political decisions, and science can advise on them. So take the issue of schools. Scientists can lay out the uncertainty. We can lay out the worry about teachers and parents and grandparents and wider community transmission. But the ultimate decision has to be made by politicians. So I think what they should be saying is they consider the science and hopefully they listen to it. But the decision and who actually has the accountability are the politicians and leaders.
Do you think it's inevitable that we could see an increase in cases of coronavirus?
I'm very sorry to say that I think it is right now inevitable looking at the numbers. The only thing that might, in a sense, save England is the good weather and the warmth if this virus does indeed die outside quite quickly. But yes, it's incredibly worrying because the numbers are not low enough to have a testing and tracing system take over. The countries that manage to exit, what we want to be getting to is where community transmission is eliminated, that you have clusters of cases appearing, and that these are like little fires that you keep extinguishing as needed through having a testing and tracing system that can quickly monitor and catch those. So coming back to the question of schools, what we want to be having is actually testing in schools. We need to be treating schools like how we've been treating hospitals and care homes. These are institutions that need to be monitored, and teachers need to be tested, older students need to be tested. We don't have yet those monitoring systems in place.
I'm interested to get your thoughts on something else as well, because SAGE has this week released some minutes from its meetings in February and March. I can see from your Twitter over the last few days that you've been pouring through them. And it's pretty clear with hindsight that some of that early advice was, frankly, off the mark. Do you think this suggests that the government got its early response to COVID-19 wrong? And does this really underline that sometimes the scientists can get it wrong too?
Yeah, I think what underlies this is actually that you don't want a small black box making decisions that's not open to scrutiny. Science is all about peer review, scrutiny, being challenged, having to defend your position and show your data and evidence. And the UK was not doing this. A group of scientists and myself wrote a letter actually right after that March 12th fatal decision to stop tracing and testing, asking to see the evidence and the data because we could not understand it, and it was not in line with what scientists across the world were doing. Some of that advice looks at stopping testing, stopping tracing, seeing this virus is unstoppable, like the flu. To be fair to the scientists, they did change their opinion by early March, and we're advocating by early March for a lockdown, and it took the government a few weeks then to actually act on that advice. But yes, I think the lesson from this is transparency, diversity at the table, as well as the mistakes that can happen when you have a small group making decisions for a large number of people.